Hey everybody, looks like we are live, and what I wanted to do today is injection day. We have people lined up to do, let's see, we're doing ankles today, we're doing a couple of knees, we even have a spine injection that we're doing. So I wanted to come in here into the injection room and kind of show you around the things that we do and the things that happen on injection day. So first things first, it'll happen. All of the people that come for injection day, they've either met with myself and or our medical staff, and their information has been reviewed by our medical staff for safety and any other concerns that there are. So when they show up here on injection day, we already know what to expect, and we've done our best to inform them on what to expect. But most commonly what will happen is people will still show up making a lot bigger deal out of the injection than it actually is. And by the time they actually do the injection, then they walk out here with the attitude of, wow, was that it? That was pretty simple. So I'm just going to show you a few of the tools that we use for our stem cell exosome injections. And if you have questions, please feel free to ask them. I'll do my best to answer them as we're live. If not, I'll come back and answer those later. So, and also I ask you, please share this video if it makes sense to you. But let's just get started. Let me show you what we've got going on here. So during our consultations, we will often meet and talk about the 4 generations of regenerative product that we have. First generation being PRP, or platelet-rich plasma. We still use that. I'm going to show you how in here in just a second. Second generation would be stem cells coming from your own body, which we do not use because they are age dependent, they cost more, and they're not as effective. The third generation was when we used them from stem cells that were derived from donated umbilical cords. And finally, the fourth generation is stem cell exosomes, which are the chemical packets, chemical messengers that stem cells secrete. We can now concentrate those down, so we're just getting the exosomes. So that is exactly what I'm going to show you today. So first things first, the patient comes in, they meet the medical staff either for the second time or for the first time, but the medical staff's already reviewed their chart. And they'll go through it. Today, Sylvia, our nurse practitioner, who's awesome, she's going to be the one doing the injection. So she'll sit down with them and then just double check everything that I've talked about to them or that the other staff has talked to them about, go through medications, make sure there's no contraindications or anything like that. So after she does that, what they will do is they'll start and they'll take a little bit of blood from whatever vein that they can get. Most commonly it's going to be from here. And they will put it into, so here is the PRP tube itself. So they'll fill this tube with their own blood. This is a 10 milliliter tube, so it's not much at all. And at the bottom of that tube, you can't really see it on the camera, but there is a white, there's an angle, that you see the white here, and there's a little bit of clear fluid there. That white is a kind of like a waxy plug that acts like a filter. So when they take the blood, they'll put it into here, and then this is our, that is our centrifuge. So they'll put the blood into that centrifuge and spin it down. And that waxy plug that I showed you will actually act like a filter to let the red blood cells settle down into the bottom, leaving us with the plasma that's up on top. And that plasma is then taken and mixed with the exosomes. So we mix the 4th generation and 1st generation. And then that is what actually gets injected into the joint. So that's PRP. Platelet-rich plasma is full of growth factors. It's full of cytokines and other goodies that help us to get a result quicker. So it's a short-term action to do that, so people can typically feel better within the week that we actually inject them. So that's PRP. Next up would be the exosomes themselves. I'm going to pull them out of the cryo tank so you can see them. Hang on for just a second. I actually have to put gloves on because these are very cold. Whew. All right. There are the actual exosomes themselves. They are smoking because they just came out of the cryo tank. So you can see there's 3 vials. I'm not going to hold that over my computer because it's dripping a little bit, and I'm imagining liquid nitrogen and computers don't mix well. So there's 3 vials there, so there's 3 joints worth there that we could use to inject into someone's shoulder, inject into someone's knee, Hey, Jen, glad you're. How come you always join me live on the afternoon ones, Jen, but you never join me for the evening ones? No, I'm just kidding. It's because you're 2 hours ahead. So that's what just came out of the cryo tank. So right before we actually do the injection, we will warm these up and mix them with the exosomes. So once those are in their appropriate vial, then what we will do let me put those away. This is our ultrasound device. So once the stem cells and the PRP, or excuse me, the exosomes and the PRP are in the vial, then we'll use our ultrasound device to get a clear picture of the joint capsule. So if it was going into the joint, then this thing will actually project to an iPad, to an image to an iPad, so we'll be able to see the needle actually go into the joint capsule. So nurse practitioner will use this to get a good shot of the joint and then inject into that joint capsule. And when I say joint capsule, what you have to understand is that we have encapsulated joints like your elbow. There's a capsule that are surrounding this elbow or this shoulder that keeps all the fluid in there. We'll actually penetrate that capsule and inject the product into that capsule. Now, there's no guarantee that the body will keep them in there. They'll send them off to wherever they need, but most commonly that's what we do is we'll put them into the capsule, and then within 4 to 6, or anywhere from 4 to 8 weeks, we expect to see the biggest result, with results lasting out for years, which is actually pretty cool. So once we're done with that, then while you're sitting here, we will go and use, this is the Giga Laser. You've heard me talk about this before. But laser and shockwave therapy, which I'll show you here in a second, have been shown to be very effective at not only reducing inflammation or arthritis symptoms, but also helps to get more of those cytokines, more of the blood flow, more growth factor. So I've actually turned this thing on, and you'll notice that those little, you can see a little tiny bit of red there coming out of the laser. So we'll use this immediately after the injection to help get more blood flow to the area, so those products can start the healing process. So these white things that you see are actually LEDs. We turn those off when we're not dealing with stuff on the surface of the skin. But that's the laser. So we'll put that over the joint, and that will run for about 15 minutes. Then the week after your injection is when we start doing shockwave therapy. Again, I've showed you this before, but I'll show it to you again. The combination of shockwave and laser therapy has been shown to create a little bit of microtrauma in the joints, which releases more cytokines, more growth factors. So we use this for a couple weeks post-injection, which has helped people a lot in getting results very, very quickly. So I wanted to hop on for a minute. That's what I wanted to share with you. It's been a short video. I appreciate you joining me. But that's basically how we do the injections. And here, starting in about 20 minutes, we're going to be tied up till about 5 o'clock doing exactly what I just showed you. So I appreciate your time. I appreciate your attention. Please feel free to reach out if you have questions. If you want me to show you more, that'd be great. I'd be happy to do it. So thanks a lot. Thanks for joining me.